Welcome everyone. Thank you for joining me today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 59 new cases of COVID-19 in Windsor and Essex County. 23 are close contacts of confirmed cases, 16 are community acquired, 1 is outbreak related, and 19 cases are still being investigated. We have had 15,970 cases since the beginning of the pandemic. 340 people are active at this time, with half of our active cases identified as having a variant of concern. To date, 1,278 preliminary or confirmed variants have been identified in Windsor-Essex County, with 92.6% of these cases identified as having the UK variant. 3 cases have the South African variant and 4 the Brazilian variant. 19 people are currently in the hospital and 3 people are in ICU. Unfortunately, I am reporting an additional death today. A man in his 50s from the community has passed away due to COVID. Our community has lost 420 people to COVID-19. There are currently 6 active outbreaks in Windsor and Essex County, 5 workplaces and 1 community. Regarding the vaccine rollout, 203,685 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 189,075 people have received at least 1 dose. Overall, 55.5% of adults 18 years and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. Those eligible to book their vaccine appointments include residents 30 years of age and older, residents 18 years of age and older living in a hotspot postal code of N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. Those 18 years of age and older with highest, high, and at-risk medical conditions, and the first and second group of essential workers who cannot work from home, and also those 18 years of age and older can sign up to be on a wait list and be called in short notice if there is availability of vaccine at the end of a clinic. Please visit wevax.ca or call 226-773-2200 to book your appointment. For all other information related to COVID and the vaccine, please visit our website at wechu.org, wechu.org. Thank you.
We'll now take questions from the media. CTV Windsor.
Yes, good morning. I'm sure Dr. Armour will probably go over this in his epi summary tomorrow, but if Windsor-Essex could reopen in the provincial framework, do you know at what level where we would be at this point?
I don't, and he probably will review that tomorrow, but I'm not sure. I haven't looked at the actual numbers to determine where we would land. Good question for tomorrow, though.
And has the health unit heard any more and been in any more conversations with the province on the possible extension of the stay-at-home order? Or is there anything new on that front?
I don't believe we've been in any discussions or participated in any, conversations regarding that at all.
Okay, thank you.
CBC Windsor.
Hi, good morning. I wanted to ask about exceeding 200,000 doses administered in our region. What does surpassing that milestone mean to you?
Well, these are the 203,000 are first and second doses. So I think as we reach the 200,000 mark for first doses, that'll really be cause for celebration. But you can see that we are moving well. The uptake in our area has been going very well. We also are acknowledging that there may be more coverage in Windsor-Essex County based on people receiving the vaccine out of our area, out of Ontario. So we are looking at how to receive that information from people who may have received their vaccine in the States. So hopefully our coverage continues to increase. Having 55% of our adults over 18 currently immunized is really good. As you know, our health unit has on the website. They have all of the little coverage categories on the dashboards, and you see them going up every day. So it's really good. It's a very good feeling, and I'm glad the receptivity and the access is being well received by our residents.
Thanks very much.
Blackburn?
Yes, good morning. I've had some questions from a listener after the announcement yesterday by the province that they plan to vaccinate the 12 to 17 age group starting in June. What have the discussions been locally, and has there been any discussion about moving teens with high-risk health conditions up in the prioritization, perhaps before that June timeline?
So we have talked about both of those issues. So we do know that the Pfizer vaccine that we're able to give right today is 16 and over, and that people, youth that are 16 to 18 years of age, or 16 and 17, and having medical conditions, that we are looking at a pathway, a better way to immunize those people. And so that discussion is happening, and we hope to have something firmed up today or tomorrow, so it makes it easier for them. The other discussion about 12 to 17, the ministry did on a previous conversation or previous meeting, we were notified that that was the plan, and we've been asked to coordinate with our locally with our school boards, and they've been part of all of our planning throughout the entire pandemic. So we do have a meeting scheduled with our local school boards to further that discussion. And we know that in Windsor-Essex County, there's probably 3,500 to 4,000 students in each of those cohorts, like those birth years. So we're probably looking at between, close to 24,000 people that would be eligible for the vaccine, based on that age criteria. So those discussions are occurring, and we'll probably have more information in the next, next week for sure. Tomorrow's already Friday.
And are there any health units that have moved to start vaccinating this group? Somebody indicated that there was, but I hadn't heard of that.
Other health units vaccinating the school age group, like the 12 to 17-year-olds?
Just the high-risk teens with high-risk health conditions.
Oh, there probably are health units. As you know, there's a little bit of variation in between the health units. Like, for instance, we're at 30 plus for our general population, and I don't know if others are there, but the other health units probably have pathways for people 16 and over with medical conditions, and we are working on a better process.
Thank you.
Windsor Star?
Nothing at this time. Thank you.
AM 800.
Good morning. Just in terms of some of the milestones you mentioned with first dose vaccinations and two dose, how would you characterize where we stand right now compared to other parts of the province? Are you pleased, I guess, with the level we're at right now?
Oh, I would say we're really pleased. Based on, where we've come since the beginning of the, having access to vaccines in our area, being part of several pilot projects, and also utilizing our primary care providers and our pharmacies, and with the municipality, all of the municipalities that support the City of Windsor, Leamington, Amherstburg, the County of Essex, to be able to offer the vaccines across Windsor and Essex County. I think we've done a great job. We're using the vaccine that we're being given, and trying to make sure that people have access. And as you can see, we've moved down age bands and opened up as much as we could to allow more access. So we will continue to do our best, but I would say we're we're doing well. And if you go, I'll talk about the dashboards again, but our dashboards give a good overview of every age band. And I know that there's been talk about, what that magic number is, but if everyone was over 80% in every age band, that would be pretty wonderful for our community. So let's keep accessing the vaccine. And if you have concerns or questions, please ask them. We'd be happy to, answer any concerns you may have.
Is there one particular segment of our population where you would like to see more of a response in terms of that segment getting the vaccine?
I am going to flip to our website really quickly as I'm talking to you, because I know that as we move down in the age groups, we want to quickly, immunize people and increase their coverage. So we know that in the older age bands, that we've done a really good job. Our community has done a good job accessing the vaccine, and I am looking at. So I'm looking at our dashboard, and you can see that people between the age of 50 and 54, there's a 58% coverage right now. I'd say unless those people have received the vaccine outside of Ontario, that could increase. So you'll see that probably tomorrow we'll be asking residents if they did receive their vaccine outside of Ontario to go on our website and complete a brief survey indicating that to see if our numbers increase based on access to the vaccine elsewhere. People 55 to 59, there's a 66% coverage rate right now, and that should be higher if we can get it higher. I really do feel like over 80% is really good for our community. Would be that kind of step closer to herd immunity we all reference. We know that 65 and up, we have great coverage, and our highest coverage rate is in the 80-plus age group, which is 93.4%. So really good coverage, but as we move down, you'll see that, we can improve in all the other age bands below 60. And let's hope we can do that. It will help all of us as we, try to move to out of this pandemic.
Thank you.
Radio Canada.
Yes, good morning. Do you have any idea when or if school will reopen in Windsor-Essex?
I don't have any information about when they will reopen. I know that is probably the question everyone's kind of wondering about. We just know that the direction for our health unit is to have a plan for administering the vaccine for those 12 to 17-year-olds, which are school-aged children. So no information about the reopening, though.
Okay, but do you think it would be a good idea to open school before the end of the year?
Oh, I'm probably not the one to give an opinion about that. I just want to do whatever's safest for our community, and keeping our case counts down and increasing vaccination coverage is really our primary goal right now.
Okay, thank you.
Any additional questions from CTV Windsor?
Yes, just one more. Premier Ford has sent another letter to the federal government asking for enhanced measures at the border. Do you think that Windsor-Essex is still vulnerable, given that we are a border city?
Well, with the border still remaining closed at this time, it has helped us a great deal. So we'll see how things progress, but that has helped us throughout this entire pandemic. So I don't know the specifics of the the letter you're referring to, and but I know that we've benefited from the action so far by the federal government.
Okay, thank you.
CBC Windsor.
No questions from me. Thank you very much.
Blackburn?
Just one more about the provincial announcement yesterday. They also mentioned about getting a pathway for second doses for high-risk healthcare workers. I know originally when they got vaccinated, they were booked through whatever the hospital system was using before you had your own system. Will they be using the health unit system, or will the hospital booking those individuals again?
So that's a very good question, and tomorrow, it's actually on our schedule for tomorrow to discuss, but we do have a plan for the highest priority healthcare workers to receive their second doses. So we'll announce more information tomorrow as we develop the pathway, to, hopefully a smooth pathway, but some people already, as you indicated, that they've received appointments for second doses, so we'll give out more information tomorrow, but it really is targeting the highest priority healthcare workers, those working in the hospitals and having direct contact with people that have COVID and other high risk healthcare workers. So more information tomorrow, but they are a group that will have be eligible to book.
Thank you.
Windsor Star?
Yeah, Teresa, so there's talk of the stay-at-home order potentially being extended. Outdoor recreational amenities are still prohibited to a large extent. But the reality is we've got good weather coming. The average temperature next week is supposed to be above the 20s. And people are gathering at parks and recreational facilities, disc golf and going for walks and hikes and so forth. And there's contradictory advice from actual scientific bodies at this point. The Ontario Science Advisory Table, the Canadian Pediatric Society, the Ontario Medical Association, they've all said that outdoor amenities should be open. Does the health unit, the Windsor-Essex County Health Unit, have a position on this?
We haven't talked about that internally. We adhere very closely to the Reopening of Ontario Act and what is provided, the regulations. And as more information becomes available, we support that and, move to whatever is allowed. But I think our stance from a public health point of view is that for our mental health, going outside, enjoying, a walk and other activities is something that will do us all good for our mental health, but it's doing it safely. And I think we've observed that some people are able to engage in activities that are you're very aware of the distancing and as we experienced last year, people were very aware of COVID and the public health guidelines, maintaining distancing and really, not going out and about if you're not feeling well. And all of those public health measures are still in place. We will closely follow the direction by the ministry and the province as we all, wait to hear which direction they're going in. But I know it's a very hot discussion right now.
Okay, thank you, Teresa.
AM 800?
I'm good.
And Radio Canada?
No, thank you.
Thanks, everyone.